Good morning, Dr. Jean here. I just wanted to give a brief statement on what we know about the correlation between grain-free diets and heart disease in dogs. It's hit the news cycle, but I wanted you all to be really informed about what we know and what we don't know, and what conclusions we can make and what conclusions we can't. So first of all, breathe easy. It's going to be okay. In July of 2018, the FDA was alerted that there may be a trend where dogs who had been on grain-free diets were coming in with cardiac disease, heart disease. So the FDA started looking into this. UC Davis has been the body, the research center that's been looking at this the most, but other vet schools have joined in too. What I need you guys to know is that there are reasons why your animals are on grain-free diets. Sometimes it's because you were coming in every 2 weeks or 4 weeks because of ear infections. Sometimes it has to do with skin disease, other inflammatory diseases, and those diseases have been handled. So we have to put things in balance. As with everything, you know, there's always two sides, and we have to consider both. What we're looking at research-wise is if the foods that are listed as grain-free are somehow causing a problem with taurine. Taurine is an amino acid in the dog. The dog can make taurine. Cats cannot. We've known this for years. We know that there's a correlation between taurine and heart disease. So these are not new things. What we don't know is why some of these dogs are coming up as taurine deficient when they're on diets that supposedly have the right amount of taurine in them. So now we're starting to look at, is it some of the ingredients in the diet and the interplay between the dog, the ingredients themselves, and what has to happen for the dog to make taurine? Is that where the problem is, or is it something completely different? And we don't really know the answer to that. And that's what's being looked at. As it stands now, the most important thing that you can do if your dog is on a grain-free diet or is not on a grain-free diet is to be mindful and watch. The things that you're going to see with a dog that has heart disease is oftentimes you'll see a change in the breathing pattern. Once they reach, you know, a serious level, you're definitely going to see a change in the breathing pattern. But look for subtle changes. Look for changes in your dog's ability to exercise. Can they run and go and do, or do they just go 2 blocks and sit down? There's other reasons why they might be doing that. They may have arthritis, they may have other conditions that are pulling them down, but heart could be one of them. Watch the golden retriever or the Labrador that you send out to bring back the bumpers, and the second bumper in, they're looking at you, they're coming in slow, and their gum color or their tongue is either purple or very pale. And you know, start paying attention to those things, because that's what's important for the veterinarian to know, to search out and make sure that the heart is okay. May not be related to the heart, but those are the things that are going to tip it off. Coughing is another very common problem that we see in animals with heart disease. So there's a lot of different things that you can monitor that would tip the veterinarian off that we better check this. What we've been doing here at the practice is when I've diagnosed dogs with heart disease, new patients that haven't previously had murmurs usually, or if we have a suspicion of heart disease, or if we have a client who's just really concerned and interested, has been following this for a while, we will send the blood out to UC Davis to check whole blood taurine levels. The cost for this isn't cheap. I want to say it kind of depends. Sometimes we can batch them and send them out together. They have to be all drawn the same day. They have to get overnighted, so that's where the cost comes in. So probably expect somewhere between $140 to $170 for that test. We have actually only found one dog in the test that we've run now. We've only found one dog that had a marginal taurine level, has early heart disease, and we're really not sure if that has to do with the diet, because she was on a grain-free diet, or if it has to do with a genetic predisposition to heart disease in her group of dogs. So there's a lot of things at play. I could talk a lot longer, but I just wanted you to know we really don't know. I do not advocate completely going off of grain-free foods. I think if you're very concerned about it and we check things out, or if you just want to change it, I mean, that's fine. But I don't think I could make that statement across the board that all dogs who are on grain-free diets should go off of them. I just see too many wins with some of my patients on grain-free diets. So I think we have to do the balance thing. Remember, the heart, in Chinese medicine, the heart houses the shen, or the emotions. And so I have seen such an increase in emotional disturbances, anxieties, and behavior problems in dogs since I've been practicing over the last 30 years. Probably within the last, I would say 5 to 8 years, I've seen a huge increase in anxiety-related disorders and behavior problems. Remember, heart houses shen, as I said, so there again, that's a heart imbalance. So if we're finally seeing that spill over into a medical condition of a heart disease, I'm not shocked. So the last reminder for the day is remember your heart. Take care of your heart. It's important. This is a hard time energetically for our hearts. So take care of it. Pay attention. Come talk to us if you're concerned about things. We can find some answers. So have a good day. Take care. Bye.